Hi, I'm Jody. I'm certified nutrition and health coaching, and I'm the national educator for Vibrant Health. Today I'm going to discuss relief for urinary tract infections and a supplement system from Vibrant Health that will support urogenital health. A urinary tract infection is among the most common adult bacterial infections and imparts a particularly significant medical burden on women, although men can also experience urinary tract infections. Postmenopausal women are severely affected by recurrent urinary tract infections. Have you ever had a UTI? If you have, you definitely don't want to experience getting another one. But have you wondered why you keep getting sick and repeatedly suffering from recurrent urinary tract infections? If you've ever taken antibiotics, they can be a major reason for getting recurrent UTIs because they disrupt the balance of the good bugs in our microbiome. Yes, our urinary tract has its very own microbiome. Typical treatment of an active UTI primarily relies on the use of antibiotics to achieve urinary tract sterility. However, this now leaves our urogenital microbiome vulnerable to UTIs. We've lost that beneficial bacteria along with the harmful bacteria. This is why I want to discuss with you alternate therapeutic strategies that can treat an active UTI caused by E. coli bacteria, which is the culprit about 90% of the time. I also want to discuss strategies that are needed to increase the quality of life and reduce adverse outcomes of recurrent UTIs. We have trillions of good bacteria that line our skin, our digestive system, and also our genital urinary system. These good bacteria have tremendous influence on our immune system. They are often the first line of defense that prevents unwanted bacteria or viruses from invading the body. Vibrant Health has a crisis intervention formula for when you are experiencing an active UTI. This formula contains a high dose of D-mannose. D-mannose is a carbohydrate sugar. It is water soluble. Therefore, it is rapidly absorbed in the body and also rapidly excreted. That makes it really important to follow the directions of taking the product every 3 to 4 hours during waking hours. D-mannose is naturally produced in the body from glucose, but not enough to produce that would remedy a urinary tract infection. D-mannose fights for adhesion on the same mannose receptor sites with the E. coli bacteria on the bladder lining. Therefore, the ability for that E. coli to attach itself is greatly reduced. D-mannose also draws that bacteria out of the bladder lining as a food source. This two-prong effect makes it easier to flush the E. coli out through urine. Studies indicate that D-mannose is effective in reducing incidences of recurrent UTIs and active UTIs. The next ingredient is cranberry. Cranberry contains 2 compounds that stop E. coli bacteria from being able to stick to the cells that line the urinary tract. Cranberry contains PACs, proanthocyanins, and condensed tannins. This, along with blueberry, tighten up the collagen bonds within the urethral tissue, squeezing that E. coli from the cell membranes. Lastly, this formula contains botanicals such as golden seal and goldenrod, and they help heal that inflamed, irritated tissue, along with uva ursley, parsley, and dandelion, which increase urine flow to help carry away and flush out that bacteria. If you have ever had a UTI, you know how important it is to start treatment at the first sensation of a UTI. This is why Vibrant Health came out with handy stick packs. You can keep with you discreetly to start treatment immediately. UT Vibrance also comes in tablets and powder. It is important to contact your healthcare provider if it does not go away. The steps following the crisis intervention are very important. Following antibiotics, or you can also take it while taking UT Vibrance, is UT Biotic. It contains 25 billion probiotics from 7 specific strains that support healthy urogenital tract. taken by mouth, these strains have been shown to colonize the vaginal tract and decrease the risk of getting urinary tract infections. UT Biotic also contains 25 milligrams of cranberry whole fruit. Cranberry extract prevents that bacteria that cause bladder infections from being able to bind to that bladder wall and cause infections. UT Biotic is important for daily maintenance of urogenital health and aids in the prevention of recurring UTIs. This holistic approach with probiotics, cranberry, D-mannose, and herbs strengthens our immune system to help break that cycle of recurrent infections. Sometimes hormone replacement therapy may be necessary for postmenopausal women. Also, drinking a lot of water is important for everyone. Avoiding sugar, urinating frequently, wiping from front to back, wearing cotton underwear, and urinating after sex. This holistic approach for E. coli infections may be your answer to avoid the traditional approach of antibiotics, which kills off our first line of defense.